Hi, this is Meredith Caldwell, and today we will be talking about the proper positioning and techniques in obtaining diagnostic upper GI series radiographs. So first, why would we use a contrast agent when doing these radiographs? Well, we would use them in cases where our patients do present with chronic or acute vomiting, hematemesis, small intestinal diarrhea or melena, possible obstructions, cranial abdominal masses, or if we suspect some perforation in their intestinal tract. There are a couple of contrast agents available. The ones that I know of are the barium sulfate suspensions, the organic iodine solution, ionic, and the organic iodine solutions, non-ionic. So we'll first talk about the barium sulfate suspensions. With this, it does come in 4 different forms: powder, liquid, paste, and tablet. These are not absorbed by the body. They do show disease or damage on the x-rays. We would not use this in a patient that we suspect a perforation. It's relatively inexpensive and easy to find and used mainly in routine GI tract contrast studies. With the organic iodine solutions, these solutions can be a little more expensive. We would use them in a patient where we suspect a perforation, and the non-ionic version is very good in very young or very debilitated patients. So it's a good option to have on hand. So this next little part, I'm just showing you what we do offer at our clinic. We do have the barium sulfate solutions, liquid form and powder form. The powder form is a little more hassle-some because you actually have to reconstitute it before you can use it. So when preparing our patient for this, we want them fasted at least 12 to 24 hours. We would, if necessary, administer a warm water enema 2 to 4 hours before radiographing. And we want our patient to be nice and clean, no dirt or debris in the hair, and all collars and harnesses removed. The next part just shows some dosing for the barium sulfate solutions for dogs and cats. It's all based on their weight. And there's also a little spot at the bottom for the organic iodine solutions, ionic and non-ionic. It's all completely based on their weight. And here's just a brief description of what the dosings are for cats and dogs for all 3 solutions. So when administering the contrast agent, depends on what your patient will let you do. You can use the buccal pouch and a syringe, or if necessary, you could also use a gastric tube to administer the contrast agent to the patient. So next is the x-ray intervals. For the barium series, you have the dog immediate 15-30 minutes after 1 hour, 2 hour, and 4 hours post from the initial start. And for the cat, you have immediate 5 minutes, 30 minutes, and 1 hour. And as you can see, the cats have a much quicker interval before they are done. They have a much faster metabolism and digestion than a dog does. And here is the intervals for the dog and the cat for the ionic and non-ionic iodine solutions. When labeling our x-rays, they are labeled just as we would a normal x-ray with all the info stated here, but we would also like the time, that is the extra added on from the initial view. That's very important when taking these radiographs. We know what time they were taken from the initial radiograph. So our GI series will end when the contrast agent reaches the colon, if the stomach gets completely empty of contrast, or if there's an obstruction and our contrast stops moving. Before starting, we will take survey radiographs, all 4 views, right and left lateral, VD, and a DV. This lets you know your technical factors and if there's any additional preparation the patient needs before starting the series. Our patient today is going to be Jetta. Here are her measurements for her lateral and her VD with her technical factors. So we measure her for the abdomen at the thickest part of the liver at the TL junction, and we're going to center over the 13th rib and include T7 to the acetabulum. And when we're doing the more cranial abdomen, we're going to still measure and center at the TL junction and include T7 all the way down to L5, L6. So the next part here is just going to show us measuring Jetta. So Jetta is sedated here for another procedure that she was going to have done today. Normally we would not want our patients sedated. When they are sedated, that does affect their GI motility, which can also affect how quickly that the contrast moves through our patient. So we would want our patient, if at all possible, alert and awake. I know that sometimes sedation is necessary, so we just need to keep that in mind if we do give our patient some sort of tranquilizer or sedation, that it can affect the timing of our radiographs. Okay, I know that the instructions were just for a feline, but I had a really cool canine GI series example. This is Cody. He is a 2-year-old Papillon. He always presented for HGE all the time. So mom finally opted for some barium series x-rays. So we're going to measure him in position. He's definitely awake. He's a little dramatic. So we'll go ahead and measure him in position for the right lateral and for the VD. That way we can get our accurate technical factors and make sure that we are doing everything proper. So here are where we're going to measure again, same as we did for Jetta. And then here is us just going ahead and taking Cody's x-rays. So the cranial portion of the abdomen, including the esophagus for R0. And then this is for the normal abdominal positioning, the right lateral and the VD. Making sure we're collimating in tightly to reduce the scatter radiation and everything like that. So here are Cody's measurements for both his lateral and VD positioning. And here are his technical factors that we use to set the machine with. And then following this portion is just his actual x-rays that we did take. The only thing missing on these x-rays that we did not do, but we do have digital x-rays, so is the time. So you can see the marker is properly there when we are a little wide on our collimation. But other than that, you can see everything for Cody. We ended up stopping this series early too because he had such bad small intestinal irritation. We just stopped before the contrast reached the colon. But this was just another cool example that I thought I would show. Okay, well, that is everything I have. Thank you guys so much. Hope you enjoyed.